This very large fibroid, another complication for me is that it was in the wall of the uterus, not on the inner lining of the uterus. My gynecologist would do regular biopsies because I was having symptoms, and these biopsies always came back and I was told, oh, no cancer, no cancer. And I proceeded to feel very badly, have heavy bleeding. I had a minor surgical procedure to scrape the inside of my uterus, and then I ended up going to a woman's health doctor that was more holistic to try to alleviate my symptoms, because my gynecologist would be like, well, if you're sleeping too much, that's probably what's making you tired. My symptoms were really dismissed. The heavy bleeding, which is a symptom of leiomyosarcoma, but in all fairness, also a menopausal symptom. Instead of anyone bringing up the growth in the fibroid, was dismissed, and I was put on medications to stop the bleeding. So I went to the holistic doctor, I went on some hormone therapy, I went on B12 for energy, and things continued to get worse. About 3 to 4 years later, I had a lot of pain, and my second ovary blew up. And they were very concerned about ovarian cancer, which was less rare, which is why what they had been concerned about when my first ovary was taken out a little over 10 years before that. So they said, you have to have surgery, you have to be in right away. And it was, I'm an accountant, and it was tax season, and I said, is it that important? And they said, yes, we're going to do a full hysterectomy. I had all my children by then. I was early 50s, and they wanted to eliminate supposedly all risks of cancer. So she said, because of the bad pap smears, we're going to do what's called a LEEP procedure on your cervix. That will take away your risk of cervical cancer. We'll get your uterus out, we'll take the ovary out, and you'll be good. So I proceed to do my blood work and pre-op testing, and I go back to my gynecologist, highly educated from great schools, supposed great doctor, and about 2 or 3 days before the surgery, I went back for my pre-surgical appointment. And my doctor arrived, and the surgery for the breech procedure was over 10 years ago, not in computerized records, but handwritten notes. And she apparently looked at those notes the night before she saw me. She looked tired, and she looked perplexed. And she came in and just said, we're not taking out your uterus. You had a breech procedure. There'd be scar tissue, and I think it's too risky for your bladder. And that's all I was told. And I just said, okay. And the procedure for the removal of the ovary and the LEEP procedure on the cervix were laparoscopic, so it wasn't bad. I had it done, back at work in 2 weeks. And I proceeded to have a lot of problems. So about, I guess, fast forward now 2 years later, the fibroid blows up to the size of a large grapefruit, and it has to come out. And again, I still have never ever been told by a doctor, although I consider myself a somewhat bright person, I always relied on doctors to tell me those things. Because it was always, it's just a fibroid, I never Googled fibroids, I never Googled the risks over 50 of fibroids in the uterus, and they are much more high risk for cancer after 50, although as you know, leiomyosarcoma is rare. So I was told I had to have surgery, but apparently this time it wasn't a rush. And it was like, we don't have a room for 2.5 months, you're gonna have to wait. And at this point, which was probably too late, I went and got a second opinion at a gynecological oncologist. That's another thing that's really important, gynecological oncologist, because again, I just didn't live in the world of medicine. I didn't even know there was a gynecological oncologist. And I went to see him, he seconded the opinion that you had to have it out. And I didn't know the questions to ask. And in hindsight, at that point, it would have been too late. So I had the surgery. And this time, to get it out, because the bladder was involved, you couldn't do laparoscopic surgery. It was more involved surgery, old-fashioned. You had to cut. It had to be a urologist and the doctor. And they took it out. I was told about 4 weeks later, actually on Christmas Eve of 2014, that I had a stump tumor, which was probably malignant. And that was done, I was being treated at Hunter Medical Center, and they're affiliated with Fox Chase, and that's what the diagnostics came back at. So I had this diagnosis on Christmas Eve, and luckily I have several cousins who are on staff at Penn Medicine, and I was spending Christmas with them. And I told her I have cancer, and 2 days later she had me in with another gynecological oncologist at Penn. And that gynecological oncologist said, well, the very first thing you have to do is give us permission to have the slides reread, because we never want to go forward without a second opinion. And I said, absolutely. I'm still in the mode very much of not knowing at the time that I was still really, really majorly underinformed. And that's why I'm hoping this will help people. But I also I followed doctor's orders. So I signed the paper, and then they called me at home and said, you're probably going to need some chemo, and your diagnosis wasn't correct, and it's leiomyosarcoma, but we think it's just preventative. And so my dealings then with that, then I went to see her again, and she kind of said, you're going to go see this doctor, an oncologist and hematology oncology doctor at the Abramson Cancer Center. Big shout out to them, because I get phenomenal care there. And she said, and it's, you'll probably have to get some chemo preventative. So I went to see the doctor, and it was the week after Christmas, and I waltzed in all happy, and I was by myself without anyone with me, because I hadn't been informed it was a big deal. And the doctor said, you need to start right away. Your cancer is leiomyosarcoma. I still didn't know it was rare. I still didn't know anything about it. And I'm like, well, how about if I start in 2 or 3 weeks? Because we're spending January in Florida. And he's like, he kind of got angry with me. He's like, you don't understand. Like, you're probably not going to live through this. Your chances are probably 50% at the greatest to survive this cancer. You need to start as soon as possible. And I just was so absolutely stunned.